so much, sir, for your kind words. हमारे साथ जूम पे डॉक्टर देवी शेट्टी सर भी जुड़ चुके हैं और वो सेकंड सेशन में हमें एनलाइटन करेंगे अपनी स्पीच से. Now we would like to call upon the stage our speakers for the very first session of the International Patients Union Conference. Ms. Nomika Khanna, Ms. Rajshri Menon, Mrs. Vandana Gupta, Ms. Shubhrita Prakash, and Dr. Neeraj Sharma. Patients have long been missing from the healthcare discourse. It is time to pass on the mic to real patients and caretakers who have experienced good days and bad days while traversing the healthcare ecosystem in India. Without wasting any time, let's hear their real stories. Our very first speaker is Ms. Nomika Khanna, a brilliant student suffering from multiple chronic disease conditions. She hasn't lost a shred of hope, and today she is here to share her experience. More power to you, Ms. Nomika. The stage is yours. Please.
Could you ever believe a day when you were only 7 years old and you enjoyed all the sweets and independence, was then suddenly asked to leave them all? Nevertheless, you were advised to take 4 injections a day. Next year, while you were desperately praying to God to not take those injections, a doctor told you to continue thyroid medications for the rest of your life. To add another cherry on top, just a few days after your 15th birthday, you get your first epileptic attack. Good morning, ladies and gentlemen, and this is Nomika Khanna, and I stand before you to narrate my life story. When I was 7 years old, I was diagnosed with type 1 diabetes. A year later, I was diagnosed with hypothyroidism. I remember as a child, I was terribly afraid to take injections. But today, I take 4 injections a day. Just when I had learned to cope with these dreaded diseases, the onset of epileptic attacks, when I was 15 years old, such as full-blown generalized tonic-clonic seizures, turned my world upside down. I felt horrible from the multiple attacks that I had to suffer in a day. That often led to multiple injuries and emergency hospitalizations. Epilepsy affected my energy levels. It decreased my ability to concentrate. It decreased my optimism and hindered my performance on many levels. I could not participate in any extracurricular activity, and initially, a girl who wanted extra homework and could not keep her enthusiasm in control was now suddenly sleepy because the medications sedated her a lot. Still, I managed to get into my dream college, that is Lady Shri Ram College for Women, New Delhi. My dream of doing post-graduation from yet another esteemed college in Delhi, even after scoring a deserved seat, took a toll. And instead of becoming a doctor like you all esteemed ones present here, I found myself on the opposite side of the table, knocking door to door to save me from the clutches of my terrible diseases. I had to wait in unending queues at the government hospitals because only a handful could actually afford the high cost of treatment at the private ones. On the other side of the coin, how is it even possible for our fellow doctors to diagnose and completely treat our patients within 5 to 15 minutes of time? I had to live with multiple side effects such as hormone dysfunction, weight gain, insulin resistance, and so much more. As a patient, even today, and I do believe that I was stressed. I do realize my family was even more stressed. The psychological strain that a patient loved one has to bear is so much. I saw my mother bravely try to hide her tears and my father trying to give me hope. Not only this, even if a person tries to, is living fully, the society comes in a way to provide some sort of unrealistic expectation. Due to the financial strain, my family could not even afford any fancy cars or go to any sort of exotic vacations. However, I've always asked myself this question: isn't it only human to play? to love, or even go to different places? Since my medical condition required constant attention, there was no one to give attention to my younger sister. My grandparents also left me because I had epilepsy, and they made sure that I feel responsible for my miseries. I think that this was a major starting point of my depression because they did not focus on my personality or even my talents. They only focused on my disability. I think living with multiple disability is definitely not an easy part. There are good days and there are bad days. A good day to me is a day without seizures. And perhaps when I'm able to carry out any of the simple activities that today we will take for granted. Yet, I believe that keeping a positive attitude, following proper diet, and yoga has helped me become really a better person than before. In my journey of being a patient, my parents showed undoubted support. I would also not would have completed my graduation if my parents had not helped me. I also believe in the Japanese concept of kintsugi, a metaphor for embracing your flaws and imperfections. In lieu of that, I have made this artwork and I've also written a poem. When I'm up against a trouble, I meet it face to face. I lift my chin up and set my shoulders bold. I pull my socks up and take a brace. I do the best that I could. I know that I might fail, but conquer something else. Candy cloud for others, why black for me? My future may seem grim and that of broken shards. I keep telling myself to keep fighting. Because the worst is that I could fail. Running from fear itself will not save me. Sometimes hope seems futile and others may turn their backs. But remember, what you're facing is something exceptional. So keep your eyes front, head high, and don't let your crown slip, princess. Thank you.
Thank you so much, Ms. Nomika, for these kind words. After such a heart-touching patient story, आइए अब भारत के हेल्थ केयर सेक्टर को केयरटेकर की नजरों से जानते हैं. Miss Rashmi Menon has been in the role of a caretaker for almost all her adult life. Juggling her successful corporate career with this hasn't been easy, but she hasn't lost hope either. Let us hear from her about her journey and experiences. I welcome you, ma'am.
I'll just remove my heels. Maybe better. This is not the end. This is not even the beginning of the end, but it's definitely and perhaps the end of the beginning. So Winston Churchill may have got many things wrong, but what he said, these words are bang on for describing today's momentous occasion, where the first patient-centered conference curated by the International Patients Union is underway. This is momentous because the patients are now getting a seat at the table, or will get a seat at the table, where the decisions are being made which will impact their lives for a very long time. So kudos to this effort, Dr. Gupta and the team. Good morning, everyone. I'm Rajshri Menon, a caregiver for my parents and my parent-in-laws. I also lead Goki Technologies healthcare business and been in the healthcare for more than 2 decades. But today, as I stand in front of you, I'm a caregiver, nothing else. 3 incidents are very clear in my mind, as stark as daylight. 3 incidents from the last 3 years. So it's rather raw, it's rather fresh. So pardon me if I stop and pause in the middle. These are the incidents where I felt utterly helpless and completely alone. The first was looking at my father, 78 years old, but a 60-year-old at heart, standing in the corridor of a very famous Kerala hospital, known for cancer treatment, with a stack of papers in his hands. He had to secure the write-off on the insurance claim. He was wondering, how am I going to get the medicines? How am I going to manage the discharge? How am I going to set up the next appointment for the chemotherapy? And all this within a couple of hours because, well, the discharge happened late in the evening. I was with my mother. My mother was having severe challenges with the side effects of chemotherapy. And I was looking at him from far and I was wondering, how is he at all places at once? But I offered a help and he said, no, let me do it. This was perhaps his last act of love. I felt utterly helpless. I don't know what I could do to help him. Why are hospitals not getting digitalized? Why the process is not getting digitalized for a seamless experience was a thought in my mind. The second was when the COVID hit and I managed to get a bed for my husband. He was #1 on transplant list by then. And the doctor, the very famous hospital, and I managed to get, thanks to all the industry colleagues, a bed in the hospital. And the doctor was sitting across to me and he said, I hope it is cancer, because then I'll know what diagnosis to give you. I was aghast. My husband was mortified. And I was saying, what kind of bedside manner is this? And I dared to talk to the doctor. Many people would be very wise and they would shut up and they say, let me not offend the doctor. But I'm never known to be wise. So I spoke my mind. And I said, doctor, this is unacceptable. You can't say things like this. But this is the second incident where I felt utterly hopeless and alone, helpless and alone. The third incident is more recent, where my father-in-law, 88 years with multiple challenges, cardiac patients, he developed a recalcitrant UTI, and then it went on to create a kidney challenge, and then there was a lungs, and everything was falling apart. The doctor was sitting across with the table with me, deciding how the end of the life should be. And I was running the scenes in my mind for the last 4 to 5 years, where I've been running from one doctor specialty to another. Because healthcare is siloed. We treat them in different ways in terms of one organ and another organ. So I was pleading with the doctors and I was saying, please talk to one another. It's very difficult for me to process everything. How am I going to keep him alive? If things are so siloed, I may not make the right decision. I can't live with the guilt of that. But that was, again, the third instance where I felt quite helpless and quite alone. So this brings forth the 3 important challenges. There are many challenges that a caregiver faces, but 3 challenges that I want to talk today. One is that even an informed caregiver like me feels helpless and alone in such situations. The siloed manner in which our healthcare operates, the doctor's sensitivity when they have to speak with the patients or the caregivers, irrespective of how bad the situation is or how terminal the diagnosis can be, and the lack of digitization in the government hospitals or semi-government hospitals, so that you can have a more seamless experience for the patients. I urge you all to think about the caregiver's state of mind. He, or probably many times she, has a lot on her plate. She's on the edge and they're fighting multiple battles. Can't we do something, anything that can throw a lifeline? Can't we get these hygiene aspects of healthcare in place so that he or she can focus on the tasks which are ahead of them? Because the caregivers, first of all, have to have or take care of their own state of mind, their own state of health first. How can you help others if you can't help yourselves first? I'm hopeful that together, all of us can solve these various very important, serious issues. The doctors reaching across to the no man's land and talking to one another about a patient's case, irrespective of whether the doctors belong in the same hospital or elsewhere. How the doctors can sensitively talk to the patients and the caregivers, irrespective of how terminal the diagnosis may be or how serious or how perplexed they are about the whole condition. And lastly, how about getting the processes digitized in the hospital so that it is a seamless experience for the caregivers and the patients alike? Since I began with a quote from Churchill, it's only appropriate that I end with a quote from the opposite end of the spectrum. There's an old Chinese saying, a journey of 1,000 miles begins with the first step. Ladies and gentlemen, and the doctors here, the International Patients Union has taken the first step. Let us march forwards together. Thank you.
Thank you, ma'am. Let us resonate with Ms. Rajshri Menon's words for a second. I would also like to inform everyone that our conference is live web telecasted on YouTube and you can ask others to join in as well. हमारी अगली स्पीकर स्वयं एक कैंसर सर्वाइवर और एक ऐसे ऑर्गेनाइजेशन की फाउंडर है जो कैंसर पेशेंट्स, सर्वाइवर्स और उनके परिवार वालों के हित में काम करती है. Mrs. Vandana Gupta has dedicated all her life to empowering cancer patients with care, from chaos to control. आइए उनसे जानते हैं भारत के हेल्थ केयर इकोसिस्टम की कुछ चुनौतियां जिनका उन्होंने सामना किया है. मैम, द फ्लोर इज योर्स.
नमस्कार और डॉक्टर गुप्ता और उनकी टीम को बहुत बहुत बधाई. और कितना इत्तेफाक है कि आज के दिन ही मेरी पहली कीमोथेरेपी आज से 30 साल पहले हुई थी. तो इसलिए ये पेशेंट्स केयर डे मेरे लिए तो बहुत ज़्यादा इम्पोर्टेंट हो जाएगा एंड आई एम श्योर हम लोग उसको अच्छी तरह से सेलिब्रेट कर पाएंगे. अब मैं आपको बताऊं, जब मुझे कैंसर हुआ था, मैं वहाँ से शुरू करती हूँ ताकि वी कैन ब्रिंग इन थिंग्स इन दैट. और डॉक्टर ने मुझे देखा 2 मिनट के लिए, पेपर देखे और बोले ठीक है तुम्हें कैंसर है लेकिन हम ठीक कर देंगे और तुम ठीक हो जाओगे. अरे ऐसे कोई होता है क्या? सबको मालूम है कि कैंसर में प्रॉब्लम होती है, कोई ऐसे जल्दी से ठीक थोड़ी हो जाता है. और हो जाता है तो फिर कैंसर को इतना तूल क्यों दिया जाता है? तो व्हाट आई वुड लाइक कि डॉक्टर्स जब पेशेंट से बात करते हैं तो ज़रा 5 मिनट या 7 मिनट अच्छी तरह से बात करें, उनको बताएं. हमारे एक्सपीरियंस में हमें मालूम है कि ये कहना है कि आप एकदम ठीक हो जाओगे एकदम गलत बात है. आप यथार्थ बताइए. यथार्थ सुनने लायक अगर नहीं है पेशेंट तो आप उनको थोड़ा समझा दीजिए कि थोड़ी तकलीफ आ सकती है, हम अपनी पूरी कोशिश करेंगे लेकिन वो सब नहीं है, हम तुम्हें ठीक कर देंगे. कैसे कर देंगे ये तो बताइए मुझे. लेकिन ये है, यहाँ पे जो अभी तक हमने सुना है वो शायद अपर मिडिल क्लास या अपर क्लास के बारे में. हमारी ऑर्गेनाइजेशन में हम जिनको मिलते हैं वो बीपीएल कैटेगरी के ज़्यादा लोग हैं, ज़्यादा उनके साथ होता है तबका. उन लोगों को कई चीज़ें पूछने की हिम्मत ही नहीं होती है क्योंकि उन्हें डर लगता है कि डॉक्टर साहब नाराज़ हो गए तो हमारा ट्रीटमेंट खराब हो जाएगा या वो अफेक्ट कर जाएगा. तो वो चुपचाप डर के मारे बैठे रहते हैं. एक तो आते ही बड़ी मुश्किल से, स्पेशली लेडीज़, क्योंकि उनके घर में ये धारणा है कि अगर किसी औरत को कैंसर हो गया है तो वो अपूर्ण है, उसको वहाँ पे रहने की कोई ज़रूरत ही नहीं है, उसको आना ही नहीं चाहिए. तो वो आते ही बहुत मुश्किल से हैं और आने के बाद पूछने की हिम्मत नहीं होती है क्योंकि डॉक्टर फाइल नंबर से उनको बुलाते हैं. क्यों? आपका और मेरा नाम है. वुड वी लाइक टू बी कॉल्ड बाय एक्स नंबर? वोंट वी लाइक टू बी एड्रेस्ड बाय आवर नेम? एटलीस्ट थोड़ी बहुत तो पर्सनल वो टच आ जाता है ना उससे, कि अगर कोई मुझसे कहे वंदना और कोई कहे फाइल नंबर BD समथिंग समथिंग, तो कौन सी चीज़ ज़्यादा अच्छी लगेगी? तो इतना तो कर सकते हैं. और दूसरा, हमेशा देखा गया है, स्पेशली अगर गवर्नमेंट हॉस्पिटल है और जहाँ पे भीड़ बहुत ज़्यादा है, मैं नहीं कहती कि डॉक्टर समझते नहीं है, लेकिन वो फाइल देखेंगे, आपकी तरफ ऊपर देखेंगे भी नहीं, आँख से कांटेक्ट भी नहीं होगा, और फाइल देखकर 2 मिनट में वो आपको डायग्नोसिस दे देंगे. 2 मिनट मतलब 2 मिनट नूडल वाली बात हो गई है कि उतनी देर में आपका सब कुछ हो जाता है. मैं ये कहती हूँ कि बहुत अच्छी बात है कि ट्रीटमेंट में गलती नहीं होती है, लेकिन पेशेंट की तरफ तो देखिए, उसको एक कॉन्फिडेंस तो दीजिए. हमेशा हमें सिखाया जाता है जब हम किसी से बात करें तो उनकी आंखों में आंखें डाल के बात करें, चाहे वो 1 मिनट का कॉन्वर्सेशन हो चाहे वो 2 मिनट का कॉन्वर्सेशन हो. सो व्हाई कांट आवर डॉक्टर्स डू दैट फॉर द पेशेंट्स? पेशेंट जो कि उनके पास आ रहे हैं पूरे कॉन्फिडेंस के साथ, पूरे विश्वास के साथ कि वो लोग उनको ठीक करेंगे, उनके साथ क्यों नहीं बात करते हैं? फिर उसके बाद में जो सबसे ज़्यादा ज़रूरी चीज़ हमारे उसमें आती है वो है साइड इफ़ेक्ट्स ऑफ द ट्रीटमेंट और डाइट के बारे में. किसी भी पेशेंट से अगर कोई बात नहीं कर रहा है तो आप उनसे डाइट के बारे में अगर बात करेंगे तो वो खुलना शुरू कर देंगे। सिमिलरली अगर आप उन्हें साइड इफेक्ट्स के बारे में बताएंगे तो वो और जानना चाहेंगे। बट ये चीज़ अगर डॉक्टर भी बता दें तो बहुत अच्छा होगा, क्योंकि मुझे बताया गया था कि तुम्हारा चांस 50% है, 50% तुम ठीक हो जाओगी। और क्या होता है, प्लेन में तभी एक प्लेन क्रैश होके चुका था जिसमें 50 लोग बच गए थे और 50 लोग मर गए थे। तो बोले अगर प्लेन क्रैश में 50% की प्रोबेबिलिटी है तो मैं भी तो तुमको वही प्रोबेबिलिटी दे रहा हूँ। ये तो कोई तरीका नहीं हुआ बात करने का। मैं अगर लिख के जाती हूँ कि मुझे ये प्रॉब्लम है तो डॉक्टर मुझसे कहते हैं तुम अपनी शॉपिंग लिस्ट लाई हो कि नहीं लाई हो। यू आर मेकिंग फन ऑफ मी. Why would I like to talk to a doctor who thinks that if I'm bringing my complaints, then it is a shopping list that I have come with? थोड़ी सेंसिटिविटी बहुत ज़रूरी है और कैसे बात करना है वो भी बहुत ज़रूरी है। पेशेंट को ऐसे मत समझिए कि वो आपके ऊपर मतलब ऐसे तकलीफ में आए हैं तो उनको अब आप कुछ भी कह सकते हैं या कुछ भी उनके साथ कर सकते हैं। I mean, from the doctor's point of view, it is also important to understand that the patient is the person you are working on to treat. आपका नाम, आपका फेम, आपका सब कुछ इसलिए होता है क्योंकि आपके पास पेशेंट आते हैं जिनको आप ट्रीट करते हैं और आपका एक्सपीरियंस उनके साथ करते हैं। तो इस बात का थोड़ा सा ध्यान रखेंगे तो बहुत अच्छा है। सिमिलरली कुछ प्रोग्राम्स हैं गवर्नमेंट के हैं, जैसे आयुष्मान भारत है, बहुत अच्छा प्रोग्राम है, लेकिन उसमें कुछ लैकुना है। कुछ हॉस्पिटल्स उनको एक्सेप्ट करते हैं, कुछ नहीं करते। मे बी समबडी कैन सिट डाउन एंड आस्क कि क्या क्या चीज़ें हैं, पेशेंट्स को पूछे उनको क्या तकलीफ होती है जिससे कि वो बात कर सकें। इतने छोटे टाइम में इतनी सारी बातें कैसे कहूँ, तो मेरे को 1 मिनट का स्लिप देकर चले गए। एनीवे, पर मेरे को लगता है, बहुत जल्दी बोलती हूँ, कि देयर शुड बी अ लॉट ऑफ डेवलपमेंट डन इन द रूरल एरियाज, जहाँ पे छोटे छोटे टर्शरी सेंटर्स हैं, ताकि लोग वहीं इलाज करा सकें और उन्हें बम्बई आने की या बड़े सेंटर्स में आने की ज़रूरत ना पड़े, जहाँ वो लैंग्वेज नहीं समझते हैं, रहने की उनके पास जगह नहीं होती है और उनको खर्चा उनका बढ़ जाता है। और एक चीज़ ज़रूर बोलूँगी, चाहे टाइम हो या नहीं हो, वो है कि क्लिनिकल ट्रायल्स। हमेशा हमारे यहाँ डॉक्टर्स क्लिनिकल ट्रायल्स करते हैं और मैं एथिक्स कमेटी में रही हुई हूँ तो मुझे मालूम है कि क्या इन्फॉर्मेशन पेशेंट के पास जाती है। 15 या 16 पेज का एक फॉर्म होता है विच इज़ गिवन टू द पेशेंट एज अ इन्फॉर्म कंसेंट फॉर्म, एंड द पेशेंट इज सपोज टू रीड इट. It's supposed to be given to the patient to take it home and bring it back after reading and signing. Doctor gives it to them and says, इसको sign कर दो. Very often I have seen myself, and I have pointed it out, a person who speaks only Marathi has been given a form in English to sign. And when I asked him क्यों sign किया, he said डॉक्टर साहब ने कहा sign कर दीजिए, तो हमने sign कर दिया. He knows nothing about it. Why? You are doing a trial on a person जिसके वजह से आपकी कोई दवाई डेवलप होने वाली है. Why can't you respect that person and be more careful about that? So that is an important issue which I think should be done. And sorry about the time, but I did have a few points to talk about, but then maybe we can talk about it later. And I hope these will be taken into account. Thank you.
Thank you so much, ma'am. We believe that Mrs. Vandana's perspective has empowered us all. हमारी अगली वक्ता मिस शुभ्रता प्रकाश एक IRS ऑफिसर है और साथ ही साथ मेंटल हेल्थ एडवोकेट भी है. Mental health has been a hush-hush topic amongst the populace, more so among civil servants, but she has been vocal and has never been deterred from voicing her opinions on mental health. Let us hear it from her. I welcome you, ma'am.
Thank you. Good morning, everyone. At the outset, I'd like to express my sincere gratitude to Dr. Gupta and the International Patients Union for inviting me to speak here and for giving voice to the missing patient's voice. At the outset, again, I'd like to tell you why I'm speaking here today. I'm somebody who has survived numerous episodes of major depressive disorder, which is commonly known as depression. I live with anxiety disorder, and I have also recently been diagnosed with ADHD. I should have been diagnosed when I was a child, but when I was a child, no one even knew what is ADHD. So I'll be talking about that area of health where not many people talk and many people do not express their lived experience, which is mental health. And in these few minutes that I have, I'll just try to capture my thoughts on the barriers which exist when it comes to accessing mental health care. And that can be summarized in, I think, 4 points. The first is the stigma. There is so much of social stigma when it comes to mental health. Anything mental health, forget about mental disorders, whether they are common disorders like anxiety and depression, or the more severe ones like schizophrenia or even bipolar for that matter. So what happens is the stigma generates a vicious cycle, like a serpent eating its own tail. So people don't speak out because of the stigma, the fear of the stigma touching every aspect of their lives, and not just there, but their families as well. And that stigma leads to silence, and silence leads to further stigma. So that's a cycle that goes on. And I truly, sincerely believe that we need to break that. And that's one of the reasons why I keep speaking about my own experience. The second aspect I would like to highlight is the disproportionate numbers that exist when it comes to the professionals available who impart the mental health care, and the number of people who actually need to access the healthcare. And here, to be honest, a lot of people don't even know what is the difference between a psychiatrist and a psychologist. And then there are psychotherapists. And unfortunately, this is one area which is also populated by a large number of quacks and people who are not so qualified to impart counseling or therapy, so as to say. And that's where people suffer. I mean, I've had my own experiences, and I'm sure anyone you talk to will have their own experiences. People often reach out to me because I provide peer support to ask me for, reliable references. But a lot of times I myself am totally at sea. I don't know who to refer them to. So this is one area which probably can be addressed with more of community mental health, maybe peer support, at least for people who are not severely at risk. And I think we could look at the framework which WHO has put out, the optimal mental health care matrix and framework. So that's something that we could look at if we're looking at solutions. Then the third thing that I would like to highlight is that mental disorders are biopsychosocial in nature. They usually occur at the intersection of bio and psycho and social factors of any person's life. So any treatment for people with mental disorders needs to cover all of this. So you might need medication, which again may work or may not work, because antidepressants did not work for me, but they do work for a lot of people. But if you go strictly by research, about 30 to 40% people with depression, I'm not talking about other disorders here, they do not benefit even from like the second or third line of antidepressants. So that's only one aspect. The other is, of course, the psyche, the makeup of a person, the mental makeup. And we need, to let us say, address the challenges there. You need good therapy. You need skilled therapists, because it's not so easy. It's not, it's not a high school physics electric circuit board that you can just fiddle around and it gets okay. The brain's neural networks are much, much, much more complex, not even understood fully. So it takes a lot of time. Therapy also needs time to work. And of course, the social aspect, like if you take a woman who is experiencing domestic abuse at home, you can pump her full of antidepressants. You can give her any kind of psychotherapy, which tells you, okay, this is not the moon, this is the sun, and everything is bright and rosy and think positive, but she will not get better. So these are things that we need to remember, because we live in a social context, in a social environment, and depression or most mental disorders are biopsychosocial in nature. Now, the fourth one that I would like to highlight today is the caregiver's burden. It's just not easy taking care of someone who has a mental disorder. I'm talking about common mental disorders. Let's not even talk about the severe ones where you have those, the dystopian, hellish establishments where people are locked up. I'm just talking about someone like me who had depression. And when I was first diagnosed, the only support I had was from my husband, who was with me standing through it all. it was very difficult to convince the rest of my family, forget about my workplace or other people. And it's only after years of patiently advocating for myself and for mental health in general that now it's much easier to explain to people what it means. But there's a lot of support which is required, and financially it's draining. Even with middle class salaried person like me and my husband, therapy sessions are so expensive. Medication is expensive. We spent a lot of money just getting better. And of course, the effect that it has, like when I look at my children, sometimes I just don't know, what has happened to them, how this has affected them, the years when I was just lying in bed, not able to get out. And so these are 4 broad categories that I wanted to highlight today. I also want to say that maybe today, if you look at me standing here talking to you, you will not figure out that I'm just about 3 or 4 weeks into recovery from my latest depressive episode, which started about a little over a year back. You will also not see the anxiety that I faced yesterday. Something just I don't know what it was that was triggering it. I was just feeling very, very anxious, and like today, even to come here, so I had to kind of calculate all my steps that, okay, I have to get up at this time, please take these many steps to the washroom, take these many steps to the car, will my driver be on time? So all of this, these are anyone can think about these steps when they have to go out to do something. But for someone with anxiety disorder, it means calculating everything to the last bit. And you would also not know how much of hyper focus it requires for someone with ADHD to sit still when others are speaking, wait their turn, and come out and speak here. But in case I've been able to make a little bit of dent in any stereotype that you held, the audience here, I'm really grateful for this opportunity to be able to do that. And I'm just hoping that we have more conferences like this in the future where patients' voices are heard. There is so much to talk about, but then there is only so little time. Thank you all. Thank you very much.
Thank you, ma'am. We thank you for mainstreaming mental health. We need more officers like you in the country. Our last speaker for this session is here to provide a parent's perspective. His Excellency Dr. Neeraj A. Sharma is the Consul General of the Republic of Palau to India. But today, for this session, at this conference, he is a parent who is here to share his experience. We welcome you, sir.
Good morning. He's like a very scary stage today. Type 1 diabetic, caregiver, cancer survivor, mental health survivor, parent. But this is reality. My introduction has been given and also told that I'm here as a parent. Time is short, so I'm just going to touch on points and go. I am here in the capacity of the founder and trustee of our organization called Chandraprabha Foundation, which is working on type 1 diabetes, more specifically on juvenile diabetes, because we are, as parents, going through that. Juvenile diabetes, in fact, today if we see, even COVID almost found a cure. But जिस चीज का क्योर नहीं मिलता हम उसको मैनेजमेंट बोल देते हैं. And being a management guru, as I'm called, or a management student, I find the word management in a very large horizon. So I don't know where to fit in juvenile diabetes, because there are children right from the age of 3 till about 16 who get this. And imagine the plight, forget the plight of the child, but imagine the plight of the parent. I'll give an example of myself. Every night the sugar of our kid drops to about 60, 70. We jump out of our bed to give him glucose, give him food to eat. He eats like we have not fed him for 2 days. And in the morning when he wakes up, the sugar is 300. So what we are now doing, we are now battling how to bring that sugar back to the optimum level, which is 110 or maybe 90, some say, because from 150, it's been going backwards. I don't want to touch that subject because that becomes very controversial, that why the parameters are going backwards. Even at 130, 140, our sugars are normal. We behave normal. The organs are working fine. People live long. But the challenge that is there is with parents and also with the people who are going through that, which you will agree to a large extent. There are behavioral issues. There are issues of how to address what are the kind of emotions and feelings that they are going through, which we as parents are not able to understand. So there is a gap area that I see here, wherein the experience, forget knowledge, the experience of what a T1 diabetic and the people around him or her face. When it happened to somebody in my family, I went to school and I told the principal that, look, this is what has happened. So the principal was kind enough to say that, don't worry, we have another student who's also type 1 diabetic. This is 6 years ago. And today, that same school has got close to 14 type 1 diabetic kids, which means that it is growing. And we keep getting calls that these are the behavioral issues, or these are situations that we are facing, like I told you, very volatile sugar levels. So what do we do? I know out of experience, and they have reached out to me, so I speak or my wife speaks. But then what about those people who are just about beginning to experience this? There is a friend of mine whose 3-year-old son has turned type 1 diabetic. He can't even say that whether I'm going hypoglycemic or I'm hungry or I'm going through various kinds of emotions. Even our kid goes through various emotions, and we are also learning. So what I am propagating today here, Dr. Rajendra Gupta ji, is that create a platform. This is a very wonderful initiative that you are taking. Create a platform where type 1 diabetics can be discussed universally, because it is not a problem just India. It's a problem in many countries, and many countries have not even accepted that there is type 1 diabetes in juveniles in their country. So we need, one, to create awareness, two, to help them manage, three, to keep the psychology of the parents in place or the people around. I'll give you one more example. I know this is live and I am going to be penalized by my father for this. One day my father was sitting in the hall and my son was there, and he told him, Dadaji, I am going hypo. Hypo means hypoglycemic. So that's the code word. So my father tells him, Beta, bhag ke jao aur glucose pee lo. It should have been the other way around. He should have run and gone and got the glass of glucose and given him. So see, these are very small things which are very, very critical. He plays cricket. My son plays cricket. So my wife is standing all the time on the fence with a bottle of water and glucose. I have no qualms in saying this because this is the first time I am talking openly about this. Till today, I have not spoken to anybody, but then I felt it's high time that we should start coming out in the open, because there may be so many of us here today sitting whose children or brother or sister may go through type 1, because for people, diabetes is diabetes, goli khalo. They don't understand what is type 1, what is type 2. When does type 1 happen? When does type 2 happen? Type 1 is not goli khalo. Type 1 is insulin. Even today, I cannot hold the Lantus pen or the insulin pen of my son because my hand shivers. There are days where he has to inject 5 times, like you were saying, he has to inject 5 times in a day, either in his stomach or in his thigh, the insulin. Apart from that, he also has to test 2-3 times a day in his fingers. So there are perpetual holes in the fingers. So just imagine the psychology, and that psychology has a cascading effect on the parents and on the relatives and friends around that person. This requires to be addressed internationally. How are we going to do this? This is something that Dr. Rajendra Gupta has to think and come up with a platform. I don't know what solutions come out of this conference today, but my humble request to all of you is, please work on type 1 diabetes for juveniles, because they are small children, innocent children, where we don't know how type 1 diabetes has attacked them, because in most of the cases, it is not genetic. I will again not touch that topic because that will become very controversial. It is not genetic, then how did it happen? It didn't come from the air. Definitely, we have taken in something because of which it has happened. It's a very serious thought to ponder. I was at an event 2 days ago, and there was an awardee. I was a chief guest, and I was then sitting on the front row. So that awardee is a professor at about 36, 37 years old in Mumbai, came, took the award, spoke, and then spoke that she's type 1 diabetic. And when she was getting down from the stage, I called her. I made her sit next to her. I said, I would like to talk to you about your experiences, because I knew this event is happening and I wanted to use this platform to create something. And she held my hand and she said, sir, I'm going hypo. And she was ice cold. I had biscuits and tea in front of me. Just then they had taken away. I got up and I ran outside, and fortunately there was ice cream. I brought some ice cream to her and I said, Yellow, have this and settle down. And after having, she threw her head back at the sofa. So see, these are the things happen. They get embarrassed. कि हम सबके सामने खाएंगे तो कैसा लगेगा, लोग कहेंगे what is this they are eating. These are the kind of things we need to create awareness about in schools, in colleges, in workplaces, in examination halls. I had a challenge because even though my son was briefed, everybody was briefed that he's T1, he missed out on the last half hour of the paper because he went hypoglycemic. In cricket, in sports, he plays and he's batting for 30 overs, 40 overs. We are on our toes. So these are experiences which need to be shared. So there's loads to talk about, but I think once this platform is created, once a specific platform is created, I think then this is where I would request all of you, irrespective of from the class that you come, from the verticals that you come, please share your experiences. Please create awareness about type 1 diabetes, because it is only management till now. We don't see any solution coming. We hear, but we don't see any solution coming. With this, I want to thank Dr. Rajendra Gupta ji and the entire team for creating this wonderful platform. And like ma'am said, we are hoping for more and more conferences, more specific areas to be addressed. And this should become a very unique platform. And yes, 6th April, I think you should initiate it. Make this as International Patients Day. Thank you so much.